Dear friend, have you ever heard of a case where a completely healthy person, just a few minutes after being intimate with their partner, suddenly collapsed and never woke up? It sounds like a rare event, but in fact, this is a completely real situation. And now, doctors are constantly warning, especially for the elderly, or those with underlying cardiovascular diseases.
Sexe. Après vite, gentle.
And happy activity can become a surprise blow to a weak heart. Many people do not know that the risk of sudden cardiac arrest after sex does not only occur in people with serious illnesses, but sometimes the small signs you ignore every day are silent alarm bells.
So, in today's video,
we will explore a very important topic together, not only for your health, but also for the peace of you and your loved ones. You will learn the early signs that your body is trying to speak up, why the elderly are more likely to experience this condition, and how to have safe, complete sex without risk to the heart. If you have ever heard, witnessed, or have a loved one who has fallen into this situation, please share your story in the comment section below.
Meb, a sincere sharing.
We'll save someone's life out there.
So, don't leave. Stay until the end of the video.
Because the following information can save you or your loved ones. Dear friend, the risk of sudden cardiac arrest after sex is not something too strange or only happens in a few special cases. In fact, this has been studied and warned by medical experts for many years. And to understand better, let's look at the specific numbers recorded by prestigious cardiovascular organizations around the world. Magnifying glass tilted right according to a report from the American Heart Association, AHA. Of all cases of sudden cardiac arrest occurring outside the hospital, up to 1% occur immediately after sex. This number is small, but if considered among millions of people at high risk, especially the elderly, it is not small at all. Because cardiac arrest often comes suddenly, without warning, and in just a few short minutes. It can take a life if not treated promptly. What's more noteworthy is that, in the group of people who experience this condition, the majority are men over 60 years old, and the majority have a history of cardiovascular disease, such as myocardial ischemia, hypertension, valvular stenosis, or a mild myocardial infarction without knowing it. In addition, a study in Japan, published in the International Journal of Internal Medicine, also showed that men over 65 years old who have underlying heart disease and are not monitored or checked regularly, the risk of sudden death within 1 hour of intercourse is 3 times higher than those without heart disease. You see, this significant difference is a very clear warning. It tells us that, as we age, and when our hearts are not as strong as they once were, any activity that causes a sudden increase in heart rate, including sex, can become a trigger for a serious incident. And more regrettably, most people who have this type of heart attack don't realize that their body has warned them in advance. So, in the next section, we will learn together what are the signs that your heart is overloaded, and when to stop and listen to your body
before it's too late.
After looking at these alarming statistics, perhaps many of us begin to wonder, why can an activity that seems so gentle and familiar as sex be so dangerous that it can lead to cardiac arrest? To answer this question, we need to understand the changes inside the body that occur during the process. Things that are often overlooked because they happen silently, in just a few short minutes. During sex, the entire cardiovascular system is strongly activated.
The heart beats faster.
Blood pressure soars. Adrenaline and natural stimulants are released, causing a chain reaction similar to when you exercise at a high intensity, such as jogging or climbing stairs continuously. For young people, the heart is strong, the blood vessels are still flexible. Those physiological changes are easily handled by the body. They may feel their heart beating fast, their breathing is rapid, but then stabilizes very quickly. However, in the elderly, especially those who have underlying medical conditions such as atherosclerosis, high blood pressure, valvular stenosis, diabetes, or have had a mild heart attack. The situation is completely different. Imagine the heart as an old pump that has been used for many years. If you pump water at high pressure continuously, while the pipes have sediment inside, it can burst, clog, or stop working at any time. Similarly, when an old weak heart is suddenly forced to work too hard, it can lead to one of the following 3 dangerous conditions.
1. Arythmia.
The heart can beat too fast, or too slow, or even contract irregularly. As a result, blood is not pumped enough to the brain, leading to dizziness, loss of consciousness, or fainting. 2. Vascular obstruction. Atherosclerotic plaques that have been stuck in the blood vessels for a long time can suddenly break off when blood pressure spikes. They flow through the bloodstream and cause blockages in the coronary arteries, which nourish the heart, leading to myocardial infarction, a dangerous event that progresses extremely quickly. 3. Acute heart failure. The heart is not strong enough to contract and pump blood to nourish the body. In a few short minutes, important organs such as the brain, liver, kidneys, etc. will fall into a state of severe anemia. If not treated promptly, the consequence can be sudden death. From a medical perspective, this is no longer a simple bedtime affair, but a strong test of the cardiovascular system. And if the body is not strong enough to respond, the consequences will be extremely serious. Unfortunately, most cases of sudden cardiac arrest have no obvious signs beforehand, or they do, but they are ignored because they are too vague. That is why it is extremely important to understand and recognize the warning signals from the body. We can completely prevent risks if we know how to listen, pay attention early, and have regular checkups. Together we have gone through the reasons why the heart, especially an old and weak heart, can collapse after just a few minutes of exertion. However, fortunately, the human body is never silent when faced with danger. It always sends out silent signals. Quiet but very clear warnings. It's just a pity that we are often too busy, too subjective, so we ignore them. And if we recognize those signs in time, a serious accident can be completely prevented from the beginning. Our heart is a miraculous machine, but at the same time it is also very sensitive. Before falling into a dangerous situation, such as sudden cardiac arrest, the body will often send out a few warning signals. Silently, gently, but if we are observant, we can completely recognize them. The first common sign, and one that can easily be mistaken for a stomach ache or chest strain, is a dull ache or tightness in the chest that lasts for more than 10 minutes. The pain doesn't have to be severe, but sometimes it's just a feeling of heaviness, discomfort, like something pressing on the chest, radiating to the left shoulder, arm, or even the lower jaw. This is the heart's way of telling you that it's under more pressure than usual. You may also start to feel short of breath even with simple activities, like walking around the house or climbing a few stairs. Feeling out of breath, having to stop to rest, and not being able to talk while moving. All of these are signs that the heart is not working effectively, and is not able to pump enough blood to nourish the body during light exertion. Next is the phenomenon of an abnormally fast heartbeat, accompanied by the feeling of a skipped beat, or erratic, irregular heartbeat. Many people describe this feeling as a skip beat, twitching in the chest, or drumming in chaos. When the heartbeat becomes erratic, it is a sign that it may be related to an arrhythmia, one of the direct causes leading to sudden cardiac arrest if not handled promptly. It is impossible not to mention prolonged fatigue, even when not doing anything heavy. You may feel exhausted after just a few simple tasks, cooking, shopping, or light cleaning. In particular, if you feel tired after each sexual intercourse, or a feeling of lethargy that lasts for no apparent reason, it is very likely a sign of silent myocardial ischemia, when the heart cells no longer receive enough oxygen to function effectively. In some cases, the body also manifests by sweating coldly after trying to have sex, even though the weather is not hot and there is no excessive exercise. This is accompanied by a feeling of dizziness, lightheadedness, as if the body has just experienced a period of exhaustion. This phenomenon is often due to low blood pressure or an excessive cardiovascular nervous response. causing temporary blood circulation disorders. And this is also one of the first steps leading to more serious complications if not detected early. Finally, if you have ever fainted briefly, even for a few seconds, and quickly regained consciousness, but for no apparent reason, then pay special attention. Fainting can be a sign that blood is not reaching the brain in time due to arrhythmia. And it is a serious warning for acute myocardial ischemia, which can cause sudden death if ignored. All of these signs, when standing alone, may not be a cause for concern. But if they appear together, or occur right before, during, or after sex, it is a bell that cannot be ignored. Remember, the heart always speaks before it falls. The question is whether we listen in time or not. Sometimes, what books or medical statistics say is not as convincing as a true story, where emotions, confusion, and the boundary between life and death are very clear. A typical case is the story of Mr. William Hong, a 67-year-old man living in Riverside District, Ho Chi Minh City. On the surface, Mr. William is a typical model of a healthy retiree. He does not smoke, does not drink alcohol, eats moderately, and still walks around the park near his house every morning. People in the neighborhood often call him the young old man, because he looks agile, cheerful, and even helps cook and take care of his grandchildren every day. There is only one thing. He sometimes feels a little short of breath, especially after a big meal or when climbing a few stairs. But he thinks it is just due to age, and there is nothing to worry about. He had never had severe chest pain, fainted, or had to go to the emergency room, until one weekend morning, after he and his wife were intimate. Something that had happened regularly, gently, as every time during their 40-year marriage. A disaster suddenly struck. Less than 5 minutes after finishing, Mr. Williams suddenly collapsed to the floor, his eyes rolled back. His body convulsed slightly, and then became motionless. His heart had stopped beating. Mrs. Linda, his wife, panicked and called for help, crying and trembling as she dialed the emergency number. Fortunately, his son, who lived upstairs, heard the noise, rushed down and performed cardiopulmonary resuscitation, CPR, on the spot, thanks to having attended a first aid class organized by the company. After nearly 10 minutes of chest compressions and artificial respiration, an ambulance arrived, continued to provide professional support, and took him to the cardiovascular center of the University of Medicine and Pharmacy. At the hospital, the doctors concluded Mr. Williams suffered a cardiac arrest due to acute coronary artery obstruction, a long-standing plaque that burst when his heart rate increased suddenly during sex, causing a complete blockage of blood flow to the heart. The angiogram results showed one of the 3 main coronary arteries was narrowed by more than 90%. But he did not know, because he had not had a heart checkup for more than 15 years. After having a stent placed and recovering for a few weeks, he emotionally recounted in a conversation with the doctor, "I thought I was still healthy, because I still walked every day, still cooked, still enjoyed life. I did not know, just a minute of subjectivity. My heart almost stopped forever." Mr. Williams' story not only awakened his whole family, but also served as a valuable lesson for many elderly people around the neighborhood where he lived. Since the day he escaped, the whole group of old friends who walk in the morning in the park have invited each other to get their hearts checked. You see, life is sometimes decided by just a heartbeat, and proactively listening to your body can save your life. The story of Mr. William Hong is a true warning, but at the same time it also raises a question that makes many older people wonder. So, at this age, should we abstain from sex to avoid cardiovascular risks? The answer from cardiovascular experts is no. Sex, if performed under appropriate conditions, is still a natural, positive, and necessary part of physical and mental life, even in our 60s and 70s. However, the important thing is, all activities related to exertion, including pillow talk, need to be controlled properly, at the right time and within the body's capacity.
Docteur affirme that
if we know how to listen to our bodies, maintain regular checkups and comply with treatment, elderly people can completely maintain a safe and harmonious sex life. So what are the practical, easy-to-apply solutions to protect your heart and still maintain your personal happiness? Let's take a look at the advice recommended by doctors specifically for the elderly. First of all, the most important thing is to have regular cardiovascular checkups. If you are over 50 years old, especially if you have symptoms such as chest pain, shortness of breath, or have had high blood pressure, then regular electrocardiogram, echocardiogram, and blood pressure checks are mandatory.
Only when you know your heart condition. Quand you know your own safety limit.
Second, if you are prescribed medication for blood pressure, cholesterol, or diabetes, follow the correct dosage and schedule of medication as directed by your doctor. Quitting medication or arbitrarily adjusting the dose to increase performance is extremely dangerous, because it can cause blood pressure to spike or the heart to suddenly beat irregularly during sex. In addition, it is necessary to avoid having sex immediately after a full meal, when the body is still concentrating blood on the digestive system. Absolutely do not have sex when you are tired, have insomnia, or have just drunk alcohol, because at these times the heart is easily overstimulated, increasing the risk of arrhythmia or hypotension. And last but not least, do not arbitrarily use sexual enhancement drugs, especially PDE5 drugs such as Viagra, Cialis, Levitra, without the consent of a cardiologist. These drugs dilate blood vessels, suddenly lower blood pressure. If combined with cardiovascular drugs you are using, or if you have a weak constitution, can cause acute hypotension, even leading to fainting or cardiac arrest. Instead of using drugs indiscriminately, choose a healthy lifestyle. Eat moderately, exercise gently every day, get enough sleep, and keep your mind relaxed. It is these little things that are the secret to keeping the heart healthy and strong. In short, sex is not a taboo for the elderly, but an activity that needs to be adjusted to suit the physical condition. With the right understanding and proactive attitude, we can completely live happily, live healthily, live fully.
After all the sharing today,
Perhaps we all realize one important thing,
health is the foundation for all happiness.
including in private life as a couple. Sexual relations at an older age are not wrong, nor should they be avoided. The important thing is to understand your body's limits and proactively protect your heart before it's too late. Because just a minute of listening to your body, a regular checkup appointment, or a little caution in daily activities can also save life. Keep smiles and peace for the whole family. Don't be subjective with any unusual signs, even the smallest ones. Don't assume that you're still healthy when you haven't had a checkup for a long time. And don't wait until your heart speaks up with a sudden fall. If the content in today's video has helped you realize something meaningful, please share this video with your relatives and friends, especially those who are entering their twilight years. Sometimes, a message, a share, can help someone avoid unwanted things. In addition, I also look forward to hearing your feelings. Have you ever encountered any of the signs in today's video? Are you regularly monitoring your cardiovascular health?
Leave a comment below.
It's not only a way for us to connect, but also a way to spread the message of healthy living, proactive living together.
And don't forget,
Click subscribe to the channel,
turn on the notification bell.
because in the next videos, we will share many other practical health topics, helping you and your family live more securely every day. Thank you for watching until the end of the video.
Wishing you good health.
Peace. And a fulfilling spiritual life, both in physical health and in loving relationships. See you in the next videos.